All right, well, welcome everyone to this webinar, Enhancing the Patient Experience with HFV and clear aligners. And I'm going to spend about an hour with you this evening discussing how we use, specifically Propel, high frequency vibration to enhance our patient's experience. And before I get started, I just want to have a few disclosures. I am not employed by any dental company. I do own stock or actually interest in dental monitoring only. And I have consulted or evaluated products for Propel, Invisalign, and dental monitoring. And in other disclaimers, I have been compensated in the past for consulting. I'm getting an honorarium from Propel for putting this webinar together. No photographs, video, or audio recordings are permitted during the presentation. At the end of this, if for some reason you have a few questions, I'm happy to answer those. If they're going to be an opportunity to ask questions, something comes up later, like tomorrow or the next day or next week, you can email me at drdonna@drdonnagalante.com. I usually get back to you in about 24 hours. If you're interested in finding out about other webinars that I might be hosting in the next few weeks, or anything that's actually going on related to clinical education, you can text Diamonds1 to 22828. You'll get on my mailing list and we'll let you know when those are happening. So, sorry, let's get started. So, for those of you that are using clear aligners, there's definite challenges, right? I think we all agree. And the things that I find, at least for us, are compliance, treatment timing, efficiency, making sure that we're efficient in scheduling properly, differentiation, like what makes us different than the person down the street that's offering a clear aligner choice, making it affordable. And I should also put down affordability, but at the same time, also profitability, for the practice, and managing those difficult movements so they were a lot more predictable. So why high frequency vibration? For us, it was how can we get patients to finish treatment faster, or honestly, even finish on time, right? How can we get adults to track better? And a lot of the problems that we seem to have in our practice center around the adult patient. And I think a lot of it has to do with not maybe wearing them enough, or moving forward when they're not quite yet ready, or their teeth are sore. If you have a patient coming in complaining, my teeth are sore, doc, my teeth are sore all the time, it's another flag for I'm not wearing them enough. And I kind of get tired of the inquisition, like, okay, how many hours are you wearing them? I mean, it's just really an uncomfortable situation. And reducing the number of appointments, I think we'd all agree that this is becoming more and more important, especially in the world we are in today, right? And by adding a high frequency vibration, specifically in our case, I'm talking about Propel, the Pro, we're able to reduce the number of appointments because the patients end up tracking a lot better. And you'll see, I'm going to show you cases. And it's a great way to add value to your services, whether you include it in your treatment fee or you add it on as an extra cost. And sometimes, you can push it through as an extra cost and add it to the treatment, or actually just include it in your services. And is there an adjunct appliance? Yes, there is. And that appliance is the V Pro. And that's why we really like it, because it takes minimal effort and minimal time and is an affordable option for our patients and our practice. So there's, two options when you're talking about speeding treatment up, or in my case, I don't even tell the patient this is going to speed their treatment up. I tell them they're going to have a great experience because their teeth won't be sore, right? And I also tell them it's going to allow you to change your aligners every week, which is a great advantage because it'll allow you to stay on track. It will also, the aligners get kind of nasty after about 7 or 8 days. And that way they always have a nice clean set of aligners in their mouth. And it's efficient. It's efficient in many ways. It's efficient for the patient because it's only 5 minutes a day. It's efficient for the practice because we give it to them day one, and I don't need to do anything else other than instruct them, how to use it for 5 minutes a day. It's a pretty simple device. We do have, as you can see, the MOPS device. We do have that. I'm not going to share that today at all with you because we don't use it except for maybe like a very stubborn tooth, like one or two teeth that are super stubborn that aren't rotating, or an extraction site that's not closing. So that's something that we do very, very infrequently with stubborn teeth, but I'm talking about the V-Pro for our adult patient base. And again, I listed some of the challenges that I think come about with treating patients with clear aligners, but there's challenges, even honestly, if you're treating patients with fixed appliances, right? The discomfort, right? Now, with fixed appliances, maybe you don't have as much non-compliance, right? Or non-tracking, and that's kind of more related to aligners, but you definitely have burnout, right? You do have some stubborn teeth, which I just mentioned. There might be some root resorption issues that you want to be careful about. And, honestly, for us, the V-Pro is a critical piece in differentiating our practice and really giving the patient the most amazing experience possible as they're undergoing treatment in our office. And the benefits: reduce pain, which is definitely, clinically, we hear this every single day from our patients. Secure aligner seating. It is a really good device for keeping those aligners seated. It has reduced our refinement rates. I'm not saying we've gone to zero refinements. I will never say that because probably 95% of our patients get refinements, and I'm okay with that. It's okay. What I don't want to have is patients having 2, 3, 4, 5, 6, 7, 8 refinements, or patients in treatment for 36 months when their original treatment plan was 12 to 18. So these benefits, most of you probably are familiar with, the fact that you get increased bone density and retention, and we do encourage our patients to keep using these in retention. We tell them it helps stabilize their bite. It also helps to ensure that their clear S6 retainers are fully seated in retention. So have you heard that vibrational force doesn't work? Okay, and there's been multiple articles out there and all kinds of information. And again, we're talking about high frequency, not a low frequency. Okay, so the vibration with the V-Pro, it's when you turn it on, it's visible. And when the patient puts it in the mouth, they feel it. A lot of my patients will say, gosh, it feels like the best tooth massager, right? It kind of reminds you like one of those portable massagers that you might put on your trapezius muscle after a long week, right, at the office, right? So it does have a very significant vibration. And there's definitely some information out there that shows how well this works, especially for what we're doing orthodontically. And there's 10 recent publications. If you're interested in getting these publications, I would suggest that you talk with your local Propel representative, and you can get this information, read through it, and then decide for yourself. But there's some amazing studies out there that really do show the power of high frequency vibration. So let me show you my patients, and what we've been doing and the types of cases we're treating. One thing I want to make clear is, for us, at least right now, we only give it to our adult patient. And the reason for that is mostly because I have found that my adult patients are the worst as far as compliance, as far as the ability of them to change out aligners weekly. I want all of my patients to change aligners weekly. So for us, it's kind of a systems approach where all of our patients are wearing their own Invisalign clear aligners, and they're changing them every week, and they're told 22 hours a day, change every 7 days. Well, it's very challenging to do that on an adult, especially if they're not compliant and they're only wearing them half the day, which many of them are on their own, not because I told them to. So here's Michael, age 39, chief complaint, he doesn't like to smile, and he's very concerned about the wear on his teeth. And Pano shows their molars were removed, and he wants a better smile, and he wants to protect his teeth from further wear and tear. So we're going to give him Invisalign aligners as well as the V Pro. And patients are instructed day 1 to use that V Pro typically 1, maybe 2 times that first, maybe even the second day, because the teeth are the most sensitive right in the beginning. Now, if we want to look at the ClinCheck, I can go into the setup. This is a deep bite setup. You're going to see, I'm going to show a couple deep bite cases. So you're going to kind of see a classic pattern here. I'm a big believer in the bite ramps, and these are the precision bite ramps. These are the ones that Align created that are kind of dynamic. As you notice, the one didn't go on right away on this upper right lateral, okay? So they kind of go on when it's appropriate or when the patient can actually bite on it. So I'm a big fan of the precision bite ramps. Definitely, I like to level out that curve of speed. Now you can see he's got a lot of wear, which makes it very tricky. And this is why I really like, using the bite ramps, because as I'm trying to get this intrusion done, he's a bruxer and a grinder. Well, he's helping me because he's written down on these things, and that's going to help get those teeth intruded so that at the end of the treatment, I got that curve of speed leveled out, and he's then not having a situation where the lower anterior teeth did not intrude and he ends up in anterior contacts or posterior bite. So, but a couple things here that I wanted to note to you too is paying attention to, teeth that are extremely rotated, or a tooth on the lower anterior that's maybe a little bit buccal and doing maybe a little bit of overcorrection, which I did not do here. And a lot of times I'll flip these around when I see that kind of situation, especially on my adults. I tend to be a lot more focused on doing some overcorrection of single teeth here or there that I think are going to be problems. So like this tooth here, I think really probably needed to be brought in a little bit more lingual, and you could have argued that this tooth could have used a little bit more rotation as far as like maybe overcorrecting it by 2 or 3 degrees. So I have a great patient, very compliant. Here he is at 5 months. And, he's pretty happy, definitely feeling better, feeling like, he's not, the clenching and grinding is, he's not doing quite as much, but we still have an issue with that tooth that I was telling you about. So we're going to go back in and do a refinement. And like I said to you before, refinement to me, every patient pretty much needs at least 1 refinement. V Pro for me ends up being something that I'm hoping will keep the patient on schedule and minimize additional refinements other than just 1 refinement, okay? And you'll notice on him, I took all his attachments off because he had informed me when he came in at that 5-month mark that he had decided to move to Reno. And it's about a 2-hour drive. I mean, it's not the end of the world, but he said to me, he goes, I'd rather not have to come back. I'd rather just, if you can just give me everything. And we had a policy in the office that, we can do that for you. And we can also send you your final retainers. So that kind of makes it really nice that he doesn't have to drive back if he doesn't need to. So you'll notice here that on the lower arch, I'm going to do, there's that tooth that I probably should have dealt with initially. The canine actually rotated quite nicely, right? And you'll see here too, the other thing that I'm an advocate of is making sure that I'm not leaving a patient with any contacts on those lower anterior teeth, which could be potential interferences. And I do like to show those heavy red contacts on the posterior and those lovely bite ramps, which I just love for deep bite cases. So He wore his aligners. He finished out beautifully in 9 months, and that's the end result. And I don't have any follow-up on him other than these pictures. He actually did come in. He was in town. He picked up his retainers, and we were able to get these final photos, which I was really happy about. So overcorrection, when I talk about overcorrection, I'm specifically talking about usually a single tooth movement. So like in this case, overcorrecting the buccolingual position of that lower incisor. Overtreatment is when you're over intruding, say lower anterior teeth, or you're over rotating, or you're over, I'm sorry, you're over extruding, over intruding, you're leveling out a curve of spee, and you're literally bringing the lower posterior teeth into a red contact. That's more of overtreatment. Let's look at another deep bite case. This is Miss Lori. She's 55 years old, not happy with her bite and that rotated canine. And again, we're treatment planning her Invisalign. We're going to use the G5 deep bite protocols and the V Pro. And you'll notice my treatment estimate was 12 to 15 months. I don't tell these patients, we're going to be done in 6 months and you're going to, no. What my goal is to finish in 12 months, right? That's my goal. And I find, and I think if you look at your adult cases, and this is kind of what prompted us to look at VPRO, we just saw like a lot of adults going into very lengthy treatments with multiple refinements, and that is totally non-productive and not very profitable. So here she is, and again, you're going to see the similar thing. We're going to use the bite ramps. Pay attention to the upper left lateral. You'll notice there's a black dot on it, which indicates a more advanced movement, right? So here you go. And there's a large rotation there that's occurring. And quite honestly, this tooth is going to be a problem. 2 reasons. One is the tooth is moving right away and there's really no space. So it ends up being a tracking issue, honestly, right from the get-go. So you got to pay attention to these type of things. I use this tooth movement assessment tool, and whenever I see a black, I always zero in on that, and I really kind of make sure that I'm focusing a lot of attention, like that movement, I want that movement to occur. I really want it. Well, what do I need to do to make it a better option? And honestly, what I should have done, I didn't do it, is I should have gone in, and this is today, I'll just demonstrate honestly what I would have done today. Is your space. I'm going to wait an hour to restart that. So here we go. So add spacing. So I do this quite a bit. I used to ask them to provide 0 collisions, right? But to me, that didn't work so well sometimes. It seemed like I still got a lot of teeth colliding. So now I actually go in there and I create my own little bit of space. And sometimes, honestly, it doesn't hurt. I've done it up to 0.5, to be quite honest with you. And you could do this yourself, or you just type it in. Doesn't matter, you can tell them. And then you put in the comments, please create 0.5 millimeters of space, mesial and distal, upper left 2, and I always do this in cap, before rotating and extruding in this case. And I'm telling you, it works like a charm, so much better. And then you combine it with something like the V Pro, which is allowing that aligner to seat and vibrating and helping to get those osteoblasts and osteoclasts to do their job even better. You start to see some real nice success. So I didn't do that, so that is going to be a problem child for me. And then the other thing that we did here that is very similar to the previous one that you saw is I made sure I had the red contacts, right? I have the bite ramps on there, right? And again, if I had to say maybe one error that I did was see that lateral incisor definitely needs some attention. I approved it without making any adjustments. And you'll see if you flip it around like this, I think most of us today would have gone in there, probably moved it a little forward, and maybe even done a little bit of this kind of deal on it, right? A little buccal root torque, right? Just to kind of make sure the root came with it. I didn't do it, so what you're seeing here did not happen. I'm just showing you what I would do today. And the class 2 elastics, I know some of you are kind of looking at that and going, well, what are those on there for? I just had her wear them about 10 hours a day. She really wasn't class 2, but she kept complaining about her front teeth. She felt like they were sticking out too much. So I thought, I'm going to give her the elastics just to make sure that when we do our expansion and we do our alignment, those front teeth don't jet out any further and make her upset. So they were only worn seriously part-time just to help control any sort of potential overjet. So 7 months later, here she is, and this tooth did not track throughout the treatment very well. Everything else tracked beautifully. And of course, I had to go back in and fix it. And unfortunately, that tooth and that lower incisor were the two problem issues. But look how nice her bite opened up. And again, you'll notice I pretty much removed all the attachments. If you hover here, you'll say, well, Donna, this is like, what's going on here? Like, you don't have attachments on there. Yeah, you're right, I don't. And if you sent this to me, I probably would tell you to put attachments on it because I would want you to definitely have success. I kind of took my chances here that this is going to close up without those additional attachments. And I just kind of set it up so that basically, the lateral was extruding and doing some rotation. And on the lower arch, we're kind of doing the same thing, kind of fixing that one incisor, see, and bringing that forward, okay? And I removed the bite ramps, which I usually don't do, I'll be honest with you. So I would kept those on if I had to do it again, all right? And here she is. She finished out in 12 months, a very happy patient. And so VPro got me to my goal. It didn't make it so that she finished 50% faster. We never tell people that. We just tell them they're going to have a great experience, minimal discomfort, and you're going to finish on time, okay? And again, you got to pay attention to things like space creation. I love those bite ramps. They are critical. And then paying attention to those individual tooth that do need a little bit of extra attention. Molly is 28 and a deep bite, spacing that she doesn't like between her two front teeth. And you can see some lower crowding. So here she is. I have a set for you. She's essentially class 1. We have a pano, shows all the wisdom teeth are removed. And I'll show you her setup. And again, very similar. You're going to see bite ramps, leveling the curved spee, red contacts on the posterior teeth. And I use a lot of the, that's the G5 optimized deep bite attachment. Here's another one. And again, these are now available in a larger size if you prefer. You can get them that way. So if we look at her, you'll notice here on the staging, everything's moving at once. The bite ramps, again, are dynamic. They get bigger, they get smaller, depending on the bite and how the lower arch is fitting with the upper. And again, if we look at this lower arch, you'll see leveling out that curve of spee. I'll show it to you from the side view, right? And again, here and here, it says intrusion, which is kind of weird. And that's kind of why I always recommend having this on, because if you hover over this, you go, why are they intruding? That shouldn't be intruding, right? You're trying to level out that curve of spee. So these are things to pay attention to. And sometimes you miss those little things because you're kind of like looking at other things related to closing the space, or maybe you're more concerned, about, the bite depth. So I love having this tool on all the time. Now, here she is. She had 21 aligners with the VPro, and here we are at Refinement. And, she's a little open back here, right? So that's not great. And I'd say that we didn't get the intrusion here that we really should have. So let's take a peek at the Refinement and look at what we're going to do in the Refinement for Molly, okay? But again, I know you guys you're going, oh my gosh, she hardly has any attachments. So one of the things I'd like to share in this webinar that I think is critical, okay, I'm talking adult patients, and I think we all struggle with adult patients who complain about attachments on their teeth, right? So one of the things that I often do when I'm coaching a patient through this process, I say, look, I really need these attachments. I'm going to put whatever I need in that first setup. So if you can bear with me, wear the aligners, use your V Pro, do exactly the prescription. I promise you that in refinement, I can remove the vast majority and only put back on the ones I really need. And I'm telling you, it's kind of like, I kind of like the analogy is like if you have a personal trainer and they're taking you through some really hard workouts in the beginning and you're just hating it, but they tell you to persevere and hang in there because it's going to get better, it's going to get easier. It's kind of the similar analogy. But you could say, well, Donna, look at this. There's a 0.54. Here's extrusion here. You have some blue dots, and you got this posterior open bite. And I get it. So I guess I take a little bit of a chance that I'm thinking that the plastic alone is going to do the job for me and really get this bite closed down, right? But again, and I think for me, it's more of just my experience in dealing with these situations and understanding what's possible. And quite honestly, when you have the patient with that V Pro in their mouth and they're kind of having to bite into it, I mean, it's a serious chewy. I mean, it's better than a chewy, but I mean, they're clamping down on that thing. The aligners are seating really well. And the liners themselves, I mean, those clear aligners from Invisalign, they have, it's a force system. So it's putting pressure on those teeth, even if there's not an attachment on there. So let me show you where we got with her. You can see my final result. I kind of overdid this. And this is typical of what I will do. I'll over intrude. Actually, I over intruded these two teeth more than I actually extruded these. And these are just the optimized attachments to kind of help with that intrusion process. And here she is finished up. And I think you'd agree that I didn't over intrude them, even though it looked like it was going to happen. And I think we got a really nice result. You could argue that I'm still a little open here, but putting her into retainers part-time, I anticipate that will settle down in time. And here's her before and after. So this was 9 months of treatment. So these are the type of cases that are winners, where you get people that leave the office, they're super happy, they're super excited. It was 9 months, pain-free, simple, not a big deal. So if you're managing deep bites, and for me, these are my critical 8 steps. Leveling that curve of speed, the G5 protocols, arch development, making sure that you're getting your expansion, you're leveling out your curve of Wilson. We didn't really talk much about lingual root torque, but it's obvious how important that is, especially on your deep bite Div 2 cases. If I have a really severe open bite, I don't think you saw it here, but on the more severe open bites, I literally open them up like it's like they look like an open bite at the end, right? The bone analysis, I didn't have an issue here. You'll see on some of my class 3 cases I'm going to show you next. The red contacts for me are a must. No contacts on the lower anterior teeth are imperative. And if you have done a lot of expansion, especially if you've attempted to do a crossbite correction, okay, you need to add buccal root torque on those upper molars, because otherwise they tip and the lingual cusps hang down and you end up with major posterior interferences, okay? So I would say that your best bet is to make sure that you follow these, like how you take, you're welcome to take a screenshot of this and keep that next to your computer. And when you're doing a deep bite case, just kind of check this off and make sure you follow these steps before hitting approve. I'm going to show you an anterior crossbite case, and then we're going to jump into class 3s. So Ben's 20, and this is one of those situations where I know you folks have these. Patient comes in, he joined the military or something, and he's going to be deployed like in, I think it was like 9 months or something. And he's like, I really want my teeth straight before I leave. So, we had no choice but to give him a V Pro. I mean, he'd be a candidate anyway, but in this particular instance, it was like mandatory because we had to get him done. And here's his pano. You can see he's got some third molars to deal with, which I'm sure they'll probably take out once he gets into the service. More or less a class 1. I didn't trace it out, maybe slightly class 3, as we'll see in a second when I show you the ClinCheck. You'll notice that he's got some small lateral incisors as well. And my typical scenario on this, now, again, I'm going to tell you what I do probably 90% of the time. There's always that 10% where things change. You can see the small laterals. I think you guys know there's probably a bolt in there, right? There it is, right? But he's also in crossbite, right? And he's got some crowding up there. So my goal in the first round is to just get the alignment. And that includes leaving some space. Now, you look at that, you go, wow, that's a lot of space, right? He's going to need veneers, right? And I knew this young man, he's 20 years old, he wasn't going to get veneers, right? But I just left it this way because I knew we were going to do refinement. I only gave him 19 aligners. That's 19 weeks. So I still have time to do a refinement. I could have gone in there right away and done some of that IPR, but I chose not to because I wanted to make sure I got these teeth lined up, and creating some extra space around those anterior teeth, I can always close it later. I can close it later. I can do the IPR and refinement. So that's the setup. And here he is. And you can see, yeah, there's space. It's not as bad as it looked on the ClinCheck, right? But the teeth are out of crossbite. So now we got to close it up because he doesn't, there's some space. He doesn't like it. So now you're going to see first aligner out of the gate, there's going to be some IPR, and I'm going to do it right away in refinement. And you'll notice I took all his attachments off. Again, why? Well, again, I was concerned just in case something happens and he needs to like leave early or something. I didn't want to have any attachments on his teeth. He could take all his 8 aligners and we could figure out worst case scenario, how to get him some aligner retainers, Invisalign retainers, if he did get deployed earlier. So, because I've had it happen. So I've been there. We treat a lot of military patients. So I'm kind of used to dealing with, people that end up getting deployed faster or something changes. So you'll notice in the staging that I did all the IPR right there at aligner 1. And I don't have attachments on there, but if you have the TMA tool on and you just kind of survey what's going on here, it's like there's not much going on as far as a blue or even black movements. And I probably opened up his bite a little bit more because I wanted to make sure I didn't leave him with any interferences. And, when you do lower IPR, you will get some deepening of the bite, right? Because as the teeth retract back. So you got to really make sure, be careful that you're not getting any anterior interferences. And it often requires a little bit of lower intrusion as those teeth are tipping back to close up the IPR spaces. So here he is at 7 months. Now, he is a bit open in the posterior, but unfortunately, I couldn't do anything about it because he is leaving town. And we basically made him his retainers and sent him on his merry way and invited him to come back if he gets back in town to visit family or whatever at some point so we could do a nice check on him. Again, I anticipate that it'll close down, it'll settle in time. It's not a whopping posterior open bite, but we were able to get him what he wanted and he was thrilled in 7 months, just in time to leave for his boot camp or whatever he was doing. Let's jump to class 3s. And I'm going to show you a couple cases here. Miss Wendy comes in and you can see we have some posterior crossbite going on as well in the molar region and some alignment issues, kind of a mild open bite situation as well. I'm not a really good pan. I apologize. The earrings were left on and I don't have a ceph to show you, but I do have a ClinCheck. So let's take a peek at the ClinCheck. And again, she's being put on Invisalign aligners plus the V Pro, right? We're recommending 5 minutes a day. If we look at the staging on her, all the teeth are moving at once. You'll notice the crossbite. And I gotta say, I don't promise adults that I'm gonna ever fully correct that crossbite. And I always tell them, even if I do correct it, it's gonna probably be the first thing that wants to relapse. So I'm just I always warn them. I'm like, this is something that is not easy to correct as an adult, and it could relapse if you're not super careful about wearing your retainers. So you'll see here, she's wearing class 3 elastics. Whenever I have a class 3 with any sort of crossbite in the posterior or narrow arch, I always put a button cut on the lingual, because that, two reasons. One, if you put the precision cut here, it kind of fights you on correcting the crossbite. And number two, if you decide you want to do a crossbite elastic, you're good to go. I mean, you might have to, add a button cut here maybe. You could do it right out of the gate, or you could just do it later yourself if you felt like you needed it. But anyway, I did have her on class 3 elastics full time. They were 4.5 ounces. And you'll see doing some expansion, having her wear her elastics and wearing the V Pro. And you'll notice here that we have some power ridges. Class 3 cases typically do need a bit of lingual root torque on that lower anterior because of a couple reasons. One, hers is not so bad, but some of them really have retroclined lower anteriors. The class 3 elastics will exacerbate it, so I always add a little bit of extra lingual root torque, somewhere between 7 and 10 degrees. And that usually gives me the extra torque I need. So here she is at the end of that first round, and we are in a refinement stage. Teeth are more or less straightened out. We got a little tweaking on this tooth to do. Still, that crossbite isn't behaving itself. This side's much better. And let me show you on the refinement what we're doing. Now, she is, this case is not finished. So this is going to be the refinement, and I have some progress to show you. But here, I didn't take all her attachments off, but I left everything on. And if you're going to do that, I will warn you, if you have a blue movement and you really need extrusion here, I would highly recommend taking this off and putting a new attachment. Okay, now this didn't have an attachment, so that's one of those things I didn't bother to add it. But again, like here, it needs extrusion, right? I would highly recommend taking this guy off and putting a new one in, because all of these are just acting like retention devices. It does help the aligner, it definitely helps, because now there's like this blob of whatever composite. That aligner has something to really grip. So they're not most horrible things to leave on, but if you really do need a certain movement, you gotta get it done. But look how nice she really looks. If it really wasn't for, like, say, that crossbite on this side, and you could argue, Donna, why didn't you just do a crossbite elastic? And I'd say, well, I don't know. But that would be a good idea, right? But I do want to point out something that's really, really important, and I didn't do it very well here. See this tooth? It's being pushed out buccally, and I have to say, when that happens, the plastic doesn't do a great job of maintaining. I mean, it'll push the tooth out, but it tends to tip it. So you really got to make sure that you get rid of this lingual cusp and really build in that extra torque up in that buccal region. So I can show you some progress on her. And this is 6 months. I mean, honestly, I had promised her in the beginning I wasn't sure I was going to be able to get her out of crossbite fully. She's thrilled so far with all of this. And the treatment time was 12 to 15 months. So we still are in the right time frame. But 6 months of treatment time in the class 3 mild open bite case, I think with the V Pro, just really shows you how well this combination works. Let's look at Matt, another class 3 with a mild open bite. You can see the flared teeth. You can see the crowding. Here's his pano, which shows a bridge on that upper left side. And I will show you the lovely setup I did for him. So this is a little trickier because I really did focus on his open bite situation, which makes the class 3 a little bit more tricky, right? So you'll see here, there's the buccal, the usual, the buccal, the button cuts that I put in. And you can see the expansion, right? You'll notice on this lower arch, by the way, I want to just point this out to you. You'll see from the side view, right? So again, he already was kind of, it's interesting because usually class threes, they're really lingual, they're really tipped lingually or retroclined. I actually kind of uprighted them because they were pretty flared out, right? I kind of brought them in. And if we hover over all these little things, you'll see that I built in a fair amount of intrusion. And here, let's just go back to number 23. And there's the superimposition. You can see loads of intrusion, right? Because of the open bite tendency. All right. So again, there's a bite jump at the end, and I'm hoping he wears his class 3 elastics. And let's see what happened. Well, he did, very compliant, wore his elastics, used his V Pro. Patients come in, and now to be honest with you, if I see any tracking issues anymore with them, I just say, are you using your V Pro or have you stopped using it? Or, and a lot of times they'll say, oh yeah, I took a few days off. I'm like, no, we really need it because I see that the aligner isn't seating as well as it did before. So I don't have to say, are you wearing your aligners 22 hours, and beat them up about that. I just say, hey, are you using your V Pro? Because I see some tracking issues. And I really need that to be worn at least, 5 minutes a day. You're welcome to do it more than that, but 5 minutes is the minimal time. I need you to get back on it. And when they do, it's really amazing how quickly things start to seat again. So he's pretty happy, quite honestly. He was happy. You know what he didn't like? Didn't like his dark triangles. So we went back in and fixed that. And like I said to you, I usually don't jump in and do a lot of IPR in the very beginning on a lot of these cases because I want to see how things settle out before I get in there and start doing this. And he said he didn't like this. So that was my main reason because honestly, he was pretty much done. I mean, if you look at this case, I mean, he closed down beautifully. We didn't get, an anterior crossbite, which probably could have happened had he not worn his elastics. And his biggest concern was the dark triangles. And so here he is finished up at 11 months. And I have a final scan to show you. And you can see how nicely everything's socked in. And here's his before and after. 11 months with Invisalign and the V Pro. So this is my treatment plan. I gave you my treatment plan for, or what I would say my checklist for deep bite cases. So here's my mild class 3 edge-to-edge bite type of prescription. And you can see, 10 degrees of lingual root torque. Sometimes I put in 7. These numbers are my go-to numbers. You have to adjust it based on the severity of the case. But again, I'm asking them to intrude certain teeth, extrude other teeth, precision cuts, although sometimes I will add button cuts when I'm in crossbite, especially on the molars. And let's finish up with some open bite correction with Invisalign. And to me, this is where, the V Pro really shines because these open bite cases, honestly, a lot of the problems I see with open bite cases is I lose tracking, especially on the anterior teeth, because when the patient puts them in, there's not a finger force, to push it on on the upper anterior teeth because they don't touch their upper or lower anterior teeth, right? They're open. With the V Pro in there, I mean, they're able to really get that device vibrating and really sinking that plastic down around the teeth. And that truly is going to help with your open bite cases. Get these aligners to seat fully, and you're going to start seeing some amazing results. So here's Brittany, and so this is a mild open bite. And again, she had previous ortho. You can see there's a fixed retainer. I didn't treat her. Her concern was her bite and the lower crowding or the lower misalignment, and she didn't like the way her canines looked. She said she felt like, they were sticking out too far. Okay, those were her main concerns. And you can see she still has all her third molars. And what we do in cases like this is I typically will scan the patient with the fixed retainer in place, and the technicians can take that off for you. That way, the patient doesn't have a whole lot of movement between the time you scan and the time the aligners are delivered. So this is a very typical open bite setup. So let me just show you, because most of your open bites are upper jaw problems. Most of your deep bites are lower jaw problems. Okay, I'd say like 80% of open bites are mostly upper jaw issues. Okay, so when you look at this, you can see this curvus spee thing going on. So I basically use the optimized extrusion attachments, and then we did a little bite jump, right? So if we kind of use a superposition tool here, okay, you can see a little bit of intrusion in the posterior. And I know some of you are going, well, Donna, this is so unpredictable. And, I don't disagree with you. So I go in there and I overdo it. Remember I said earlier about overtreatment versus overcorrection. So I'm overtreating this by over extruding basically 2 to 2. So these are those optimized attachments for the open bite cases, right? And you'll see on the lower, if we look at the lower posterior, a little bit of intrusion, especially in the second molar region. One of the key things to highlight when you're looking at an open bite case for the first time is to go in there. Let me get rid of the superposition for you. Go in and just see, like, where is she hitting? I mean, she's not bad, right? Sometimes you get like these open bites where like the only marks you're getting is on the second molars, right? So she's really not that bad to start. But again, I went in there, I did the expansion, and I ended up extruding those anterior teeth. And while I hope this doesn't occur, I'm over extruding those upper anterior. I'm over treating this. I don't want all of this to happen. But in order to get what I want, I have to overdo it slightly and monitor it carefully, right? So here she is at the refinement stage, and things are looking better. She's much happier about the way her canines look. She's much happier about, well, her bite's still off, but she's definitely happy about the lower alignment. So again, putting her back in to a refinement stage. She's using her V Pro, which she loved. And I left pretty much these guys on. If I didn't get what I wanted, I would have taken these off, okay, and added new ones. Okay, so if I didn't get, like, look at that. I think that looks pretty good. I think you'd agree. In fact, let's look from the side view. Do you remember? Look at that. I mean, I pretty much got what I wanted with my overtreatment in place, okay? So now we're at the point where we got to deal with, I probably, she's a little open, right? So we got a little optimized extrusion attachment there, same here. And we're doing a little bit of IPR because we do have an issue with, oh, I thought she had a heavy contact there. She actually has a contact there, but she was hitting here, and I don't know why it doesn't show it, but we're trying to minimize that and just do a little bit of IPR and just deepen the bite just ever so slightly. So here she is. She finished that treatment beautifully in September. And you could argue with me, well, she's still kind of open back here. And I'd say, yeah, but she was an open bite to begin with. So I'm just going to let that all settle out. And we'll be following up with her in refinement, or in retention, I apologize. And here she is before and after. And you can see the change. 5 total appointments, 5 months of treatment. And those 5 total appointments, by the way, include the initial exam, the aligner delivery, right? The refinement scan, the refinement delivery, and the retainer delivery. Okay, so that's what that comes out to be. Very efficient treatment. I think you'd all agree, right? And very productive and profitable. Let's look at Scott, another open bite case. He's a teacher and concerned about his smile and his teeth. And I have a Ceph for you to look at. He definitely has a vertical skeletal pattern, mildly class 3 as well. Some third molars that are still up there. So I had suggested or told him about 15 to 18 months. You'll notice my time frames. It's not like I'm, the previous patient, I believe I told her 12 months. I mean, she finished really fast. And by the way, if that does happen, I do want to make a mention of this. If that does happen, because sometimes it will, we always tell a patient, retainers are included, and retainer checkups are also part of the treatment. So we'll be monitoring you. We have them continue using their V Pro about once a week to make sure that the aligners are, the retainers are seated. So they still feel like they're in active treatment because we follow them for about a year. And sometimes on the open bite cases, I actually will follow them a little bit longer. at no charge to them, just because I want to make sure, things are really stable. Okay. But 15 to 18 months for my friend Scott here. So let me show you the setup on him. And again, you're going to see a similar pattern. The difference is here, he is going to be wearing some elastics. And let me just show you what this looks like from the side view. And oh, I apologize. There are no elastics. I thought he had class 3 elastics. No, it's just pure open bite intrusion setup. So here again, let me just go back. I want you to look at this. So that, again, like I said, most open bites happen to be upper arch problems. So a lot of times, and he doesn't have a huge curve of speed, but I mean, there's enough of a curve there. And if you hover here, you can see I built in fairly significant intrusion. So again, using the superposition, you can get a sense how much, and then we have the little bite jump there that occurs at the very end. And then on the lower arch, most open bite problems don't need a whole lot on the lower. If anything, maybe a little bit in the molar region. But even then, sometimes I'm doing very little because a lot of it is really honestly an upper jaw issue. And you can see here, when we finally do the bite jump on him, let me just jump to the end. You're getting things closed down. I didn't have to place attachments on these upper front teeth because the reality is I wasn't really extruding them that much. I was mostly focused on posterior intrusion in this case. And any extrusion that maybe I needed, I was going to get from some tipping back of those teeth, after you kind of do a little round tripping, line them up, and then tip them back. And he finished out that first round. Here he is. And, he had some compliance issues, so I'm not saying he was a perfect patient, okay? But he was continuing treatment, and thank goodness we had the V Pro, because I think it really did help, even though he definitely was not. I mean, there were times where it was obvious that he wasn't wearing them full time, and I had to move him into like sometimes an extra week or a 10-day cycle just to kind of keep things tracking. So here we are at additional aligners, and you'll notice, and we had, the one thing about the V Pro too that I do really like is that it does help patients, especially those that maybe call up and say, hey, you know what, I can't switch to the next aligner, my teeth are really sore. I'll just say, look, start using that V Pro once in the morning and once at night, because that'll really cut the sensitivity down if they're really complaining a lot that their teeth are sore. And you'll notice here now I have some IPR programmed in here. He didn't like the dark triangles, quite honestly. And we're just trying to get the bite to close down. Sometimes on these open bite cases, I mean, sometimes I'm so successful at getting the posterior intruded, it's like I almost did too much. And then I'm going back in and extruding things, which I'm not really sure how smart that is, but in this case, I did it. Just to make sure that, he had a nice occlusion. And some patients really feel uncomfortable if they don't have their back teeth touching. And he was touching a little heavy here right in the front. And so we did the IPR, and here he is finished up very nicely. Here's progress. And then here he is finished up. It took 16 months. And I had told him 15 to 18. So we still ended up right in the ballpark, which is wonderful because I know that patients start to burn out at about month 19. By 20, they're really wanting out, right? And if you can get these patients finished in 18 months or less, you are going to be a hero. And they are going to be telling their families and friends and neighbors who are in treatment for 36 months and on their 10th refinement that they only had one refinement. I had one patient come in that was referred, and she was telling me, she said, I heard about what you guys were doing, and my mom went somewhere else and she was in treatment 4 years and she had like 15 refinements and her teeth still aren't good. So I think, you can set yourself apart by offering these adjuncts to make the experience for your patient outstanding and exceptional. And believe me, they're going to be the ones referring patients into your office. And we're all going to need some new patients coming up here soon, right? When we're finally allowed back in. So here he is before and after. And in retainers. And again, if I want to show you my open bite, this is my typical setup. I don't do a lot of intrusion of 5s, by the way, but sometimes it is necessary. I do have a clear approach to refinement. Patient is scheduled to be seen when they have 2 aligners remaining. I will evaluate at that point whether they're finished or need a refinement. If finished, we order the retainers off the last aligner, especially if the aligners have been tracking beautifully. There's no reason not to order it. You can order it directly from Invisalign. And if additional aligners are needed, obviously you scan them. This is critical. I let the patients move forward with their aligners. So they have 2 more sets and we're waiting for refinements. I tell them, go ahead, keep wearing them, keep doing what you've been doing, 22 hours. Do not get them out of the habit, okay? Because if you tell them to go nighttime only and then you come back and you're like, oh, you got to wear these full time, they're going to be like, what? I like the nighttime only. And that's just not going to usually work for most of your patients. So here are my final success strategies, and then I'll open it up for questions. So every adult patient receives a vPro as part of their inclusive treatment fee. The prescribed use of 5 minutes every day, sometimes 2 times a day in the first 3 days. We see them every 12 to 16 weeks. And then we do have them change every 7 days. Everybody in the office changes every 7 days. It's so much easier just to have that as the mantra in the office, right? And it's easy for patients to remember every 7 day, every Thursday, right? Every Friday, every Saturday. So much easier than doing like a 10-day cycle or a 3-day cycle or a 5-day cycle. It's definitely impacted the patient experience. Patients are tracking well, even when I know they're not wearing them 22 hours, because I know they're not sometimes, but it's still tracking pretty well. And it's definitely added value to our treatment and differentiates our practice. So I think, while I can't say it eliminates refinements, I think it reduces the need for more refinement and excessive treatment time. So if you can get out of treatment in 1 refinement, I mean, that is a winning strategy and a very profitable one, a very efficient one. And the cost of whatever the vPro, that is a benefit. Think about minimizing multiple appointments with your patients, the cost of having them come in and the chair time and the expense. And, I just thinking about what's gone on recently, with, shortage of face masks and protective wear. If you can minimize how many times patients coming into the office, well, that's going to minimize the impact on all of your sterilization needs and your personal protective equipment, as well as, minimizing the impact on you and your staff as far as any sort of, viruses or bugs or bacteria or whatever they bring in, right? So to me, the virtual world is here. And, we make Invisalign is a big part of our practice, and vPro is a big part of our success strategy for our patients. So I'm going to open it up to questions and at this point, and you can type them in if you have any. There's a little box and I will answer them. All right. Well, I don't see any questions, which is awesome. And that's fine. And like I said before, if you want to reach out to me later, Dr. Donna at drdonnagalante.com. And I'm happy to, oh, here's a question. Let's see. Do I use it with fixed ortho? Great question. Yes, although I will tell you, we don't do a lot of fixed appliances on adults, but if I do have an adult in fixed appliances, they do get a vPro. So I think for us, it's always been an adult appliance. I may give it out sometimes to some of my college students that are leaving town and have them, even though it's not part of their quote unquote comprehensive treatment fee, we just add it in, so it's like in there. So I don't say, oh, it's optional. It's never optional. Like if I prescribe it, and I tell my treatment coordinator, I say, I'm prescribing vPro for this patient, right? And it might be like an 18-year-old that's going off to college, right? that's prescribed. So it's added to the treatment fee, right? It's not an option, they don't have a choice. So, but yes, we do use it on fixed, but I have very few adults in fixed appliances. And the next question is, thank you. You're welcome. Thank you for joining me, and hope everyone's staying well. Question from Gary. When you order your refinement 2 stages prior to the end, where do you start the refinement? Do you project the start of the last aligner? What we do is when you upload it, this is a great question. You upload it, you tell, like on the refinement worksheet, you tell them that you are basically submitting it at stage 22 of 24, right? So what happens in my experience, right? This is my experience with it. A lot of times, a lot of the movements, say 23 and 24, are worn by the patient, so they come back in, they're ready for the refinement. And the technicians basically have set it up based on your scan. So I find that sometimes they can skip the first 1 or 2 aligners because actually the movements actually occurred. So again, it's never been an issue for us. Like the other option that you have is you can actually, just ask for the last 2 aligners to just be passive. You can just make it a stock thing on your prescription. Provide 2 passive aligners at the very end so that the patient comes in, let's say 22, and that's their last active one, and then you have 23 and 24 are passives, and they're still wearing them thinking that things are moving forward. I just don't want the patient to get out of the cycle of wearing them full time. Okay, so either way it works pretty well, but you will find sometimes that when they get their refinements back, they can actually skip ahead sometimes to like the second one or even the third one. Hi, Paul. Thank you. I'm glad you're on board. Thank you for being here. And thank you, Jack. And thank you, Gary. Yes. So hopefully this was helpful. I know I talked really fast and I covered a lot, but wanted to show you a variety of cases: deep bite, class 3, open bite. And so you get a feel for, that this can be used with a variety of situations. And I have just found it to be just honestly magical for our adult patient. And I think we'd all agree the adult patient can be a bit challenging from just the psychology of treating them, right? They just need a lot more coaching. They need a lot more hand holding. And this just really helps smooth out the process because they just are so much happier. They're not complaining. So, Carolyn, you asked about the fixed appliances. Yeah, I mean, it really does help a lot because a lot of the soreness that they have, it's coming from the tooth movement. And if you can give them this V Pro and it helps, it's like a tooth, a couple of my patients call it their tooth massager. It does do a great job at decreasing that discomfort for them. And I certainly would, we give it out to every adult. It's part of our package deal. All right, thank you. So let's see, how do you retain open bite patients? Do you add any tongue spurs? Good question. In retention, it's a good question. In retention, when they're coming back in for follow-up, if I see that I'm getting some relapse, right, that they're opening up again, what I'll do is I'll take their retainer and I'll cut into it. So like it's usually the upper arch is the problem because like the tongue's getting up there again. And I'll just take, if you can just visualize like a little crown and bridge scissor, I'll just cut like little cuts into the aligner right up near the gum line, say from 3 to 3. And then if you really want to you really want to be mean, you can kind of take a Weingart and just like kind of bend them up a little bit. I'm going to tell you that works really well. Their tongue starts hitting that. It's like tongue spikes. I mean, it's like the tongue spurs that you're talking about. So that's kind of how we manage it. Orofacial myology is awesome. I unfortunately have not found somebody I can refer patients to, and I'm not trained in it. So we kind of just use like the tongue spurs, or we alter some patients I've actually had to give them a Holly with like a little, tongue spurs hanging down if it was really bad, and wear that at night, and then wear the clear one during the day. But I will tell you though, having the plastic on the posterior and making sure they're using that V Pro and retention and really engaging the posterior teeth to keep them intruded helps a lot too. Thanks, Martha, and thanks. Oh, so Tariq, thanks, Donna. For class 3, do you always use palatal buttons? I do if there is a crossbite or a narrow arch. Otherwise, no. Otherwise, I just put them on the buccal because patients really don't like them on the palatal like that. But I tell them that it's going to happen and I need it, and their tongue might be a little irritated. But I'd say 50% of your class 3s are in crossbite too, right? So you kind of oftentimes need to do it that way. Do you have problems with loose contacts after IPR? Yes, I do. And it says, do you do less than prescribed? Yes, I do. I am notorious for telling the patient, I'm only going to do half of what was prescribed, and we're going to monitor it as treatment goes along. And if I need to do a little bit more later before the end of treatment, I will. And I find that sometimes I do have to go in, but it might be just like one tooth versus like 3 or 4 or 5. So be conservative with your IPR. If I had to tell you one thing, be conservative. And then also, do you find that there's loose contacts after expansion? Yes. So what you can do here, if you're submitting a refinement for this, you kind of 2 options. Okay, one option is I'll ask for virtual C chain from 7 to 7, right? Just say I want virtual C chain, molar to molar, 7 to 7, 8 to 8, whatever teeth are there. If that seems like that isn't doing the trick for you, then what you do, I call it fake IPR. I'll go in between, say it's like your 7s, like usually I find it's between 7, 6, and 5. I'll actually go in and do IPR in between the teeth, like I'll program it, but I won't do it. So what will happen is it'll show that the patient's going to have it, but don't do it, because what happens is the software assumes you did it and they're going to try to close the space. So I will often do that if I really have some really stubborn spaces. So virtual C chain 7 to 7, I'd say 80% of the time works. And then if that doesn't do it, do the fake IPR. And that works super well. Just tell your staff it's not real. My staff is like kind of, and I tell them, if you ever see any IPR on 7s and 6s, that you know it's got to be fake, because I never do IPR back there. So they automatically know it's fake. She's just trying to close some contacts. So fabulous. Any other questions? Those were all excellent questions, and I appreciate y'all being here. And again, you'll get an email with a link to your CE credits. So nothing better than staying home and relaxing and getting a CE credit at the same time. It's pretty awesome. So I want to thank Propel for having me, and thank everyone on the call for being here tonight. And stay healthy, stay well, and look forward to meeting some of you in person someday in the future. Good night.